Hello there, YouTube. Dr. Carlo Ojeda with DrER.tv. I am a board certified emergency physician and I've been doing educational videos on ED Exit Video Pro targeted at medical healthcare professionals. If you want to be at the cutting edge of knowing the latest cases, the cool stuff, this is a place to be. In 5 to 6 minutes, I'll give you a cool case presentation and you'll learn a lot. I've certainly been learning plenty making these videos. Hey, this is the case of a 15-year-old boy who presented to emergency department with abdominal pain. He did not have a fever, but the abdominal pain had been going on for 2 days. He had local peritoneal signs. That means that the pain not only it hurt, but it hurt to be wiggled, to take a step, to shake the belly, and more pain in McBurney's point. The McBurney's point is about 1/3 of the distance between the belly button and the superior iliac crest, the right lower quadrant where most people point to with the appendix. Laboratory findings show a white count of 22,000. That's very high. Normal is about 10.5. And a C-reactive protein, which is a non-specific test for inflammation, that was also very high. Abdominal ultrasonography failed to visualize the appendix. In 15-year-old in kids, we would like to always do an ultrasound first. If appendicitis is identified, you got your diagnosis and you avoid the radiation risk of a CT scan. In adults, we almost always do CT scans. Most hospitals, however, do not do ultrasound for appendix because it requires a very well-trained ultrasonographer. And usually you get those, the more practice they have doing it, which means it's usually pediatric hospitals. However, it detected multiple marble-like objects. What? With hypoechoic rims and hyperechoic centers over the epigastrium. The epigastrium is that area in the upper part of the abdomen, right at the V of the rib margin below the sternum. Abdominal computed tomography, or CT scan, showed engorged appendix, which confirmed the diagnosis of acute appendicitis. So this was a very clear case of appendicitis, both by history, by white count, by exam, and usually you don't even need the CT scan at that point. But since he had this weird detection of these objects, marble-like objects, we have to look further. CT imaging also incidentally revealed multiple small round hyperdensities in the distended stomach, arrowheads. Let's see what that's all about. What is that? So that's an ultrasound. You got this, I don't know, alien-like structures, you know? Any idea what that is? Because I had no idea. And obviously the ultrasound shows here what the location of that ultrasound is. This is the CT scan, and you can see all those marble-like structures in the stomach. So that was on ultrasound. It almost looks like coronavirus, doesn't it? And then this is on the CT scan. And why is this picture here? Well, that's giving us the answer. Tapioca perils of boba tea. Tapioca. The patient had ingested bubble tea the night before the ED visit. Bubble tea, also called boba tea, is a traditional Taiwanese beverage made with tea, milk flavorings, and edible tapioca bubbles or pearls. CT images of tapioca pearls appear as well-defined scattered spherical hyperdensities, usually located inside the stomach or duodenum. That's the part distal or further down the stomach. Tapioca pearls are less hyperdense than fecaliths or appendicoliths. Liths are stones. Fecal means stones in the stool. Appendicoliths on the appendix. To our knowledge, there is no literature describing an ultrasonographic finding of tapioca pearls. In our case, ultrasonographic imaging of tapioca pearls revealed distinct marble-like objects with hyperechoic rims and hyperechoic centers. Acoustic shadows could also be found depending on the echo densities of the pearls. Acute appendicitis was the definite cause of the abdominal pain in this case. The ultrasonographic findings of tapioca pearls in the stomach can be misleading for the inexperienced healthcare providers. Count me in, because I had no idea what that was until I read the article, until I prepared this little mini lecture for you guys. So we learned that tapioca pearls of boba tea in the stomach looks like this. And on a CT scans like that, so when I do finally see this thing, I will know what it is, and so will you. So thanks for watching this video. Please let me know that you did learn something, that you find it interesting, that you want to see more of this kinds of videos, so that I can keep creating content just for you, and you can become the next level healthcare professional by knowing these little pearls, pun intended, tapioca pearls. And that's it for today. Thank you so much for watching. Bye bye.